Hi, today we will very briefly discuss about urinary tract infections in children. Parents need to understand that urinary tract infections are very common in children. There are two types of urinary tract infections mainly. The urinary tract infections which occur with fever and urinary tract infections which occur without fever. So we will concentrate mainly on the urinary tract infections with fever because that means it's a kidney infection. Urinary tract infections without fever are usually bladder infections. So kidney infections are more important because they have a potential to damage the child's kidney. They are very common in children. Typically, when a kidney infection occurs in a child, they may have only fever. They may not have the typical urinary symptoms. So our advice to all the parents and all the pediatric doctors who treat children is, any child who has unexplained fever, it's better to do a complete urine examination and if necessary a urinary culture, just to check that you're not missing a urinary infection, because most children kidney infections are very common and they present mainly with high-grade fever, sometimes with vomiting and loose motion, so misleading the parents and the doctor. But the actual problem sitting there could be a urinary tract infection. And it's very important to recognize urinary tract infections, because if the child had a kidney infection, then they need to undergo some basic tests to find out why the child is having kidney infection, so that repeated infections and kidney damage can be prevented.